Hi everyone, I'm here to talk to you about some really exciting multiple sclerosis research that's just been published. It's only been available for about 10 seconds or since I started talking at the start of this video, but the embargo's just been lifted by the journal. Now this research is so exciting and so significant that we wanted to make sure that we told you about it as soon as possible. So without wasting any more time, let me tell you what they found. And the research paper that I'm talking about is this one. And it's just been published in JAMA. And to put this in perspective, JAMA is the third highest ranked medical journal in the world. And in 2018, they only accepted one research paper about multiple sclerosis, this one. So it highlights how important this work actually is. So what were they looking at? Well, really their research question was to assess whether treatments for multiple sclerosis are effective at delaying the conversion from relapsing remitting MS to secondary progressive MS. Now we're going to be doing lots of coverage of this research, and so I'll be doing articles where I'll go into more detail about how they actually performed this study, but for now I'll say that this was done on a large cohort of people across a long period of time using the MS-based database. But for now I just want to really focus on the findings. And so there were three main findings of this study. The first finding is that treatment works. People on treatment were less likely to advance to secondary progressive MS than those receiving no treatment. The second finding was that people treated with fingolimod, natalizumab, or alemtuzumab, or Gilenya, Tysabri, or Lemtrada, were less likely to progress than people receiving interferon beta or glatiramer acetate or Copaxone, suggesting that the newer highly effective therapies were better at delaying this onset. The third finding was that the effect was most significant when the treatments were started within the first 5 years of disease onset, indicating that early and aggressive therapy may be the best way to achieve long-term benefits of delaying the onset of progressive disease. So why is this important? Now, at this stage I can say that both Associate Professor Thomas Kalinchik from the Clinical Outcomes Research Unit at the University of Melbourne and Dr. Will Brown from the University of Cambridge, who were the lead researchers in this study, are both likely to appear on MStranslate over the coming weeks to talk about this research in more detail and to answer your questions. So it's fantastic that we're going to be able to have access to them to really be able to go into the importance and the significance of this study. But for me, there's probably two main reasons why this is such an important and exciting study. Firstly, this information really gives us confidence that the treatments are effective and that they're providing long-term benefits for people. Now, obviously, there are lots of decisions that come into play when people are trying to decide what treatment to make, lots of factors that come into play when people are trying to decide what treatment is best for them. But this gives some really good information that both neurologists and people living with MS can use when making those decisions, but being confident that these treatments can have an effect in the long term. So why is this step so important? Why are we so interested in delaying the onset of secondary progressive MS? Well, we know that once people progress to this secondary progressive form or convert to this secondary progressive form, from that moment on we start to see an accrual of disability, a gradual worsening of disease. And often at this point, the treatments become less effective. They stop working. So if we can increase the time it takes for people to progress to that form of the disease, we're really helping improve the quality of life for people living with MS. And so I think about it like this. I think about it like the alarm there is the progression, that step to secondary progressive MS, but using these treatments is helping push that snooze button, delay that point of having to get up and get out of bed. And so this is really exciting, important work. We hope that you're interested in it as well. Please make sure that you like, comment and share on this video so that as many people in the MS community can see it as possible. And we'll definitely be talking to you more about this in the future. Thanks.